For the case study I chose was hypertension. According to the World Health Organization, hypertension, also known as high or raised blood pressure, is a global public health issue. It contributes to the burden of heart disease, stroke, and kidney failure, and premature mortality and disability. It disproportionately affects populations in low and middle income countries where health systems are weak. Hypertension rarely causes symptoms in the early stages, and many individuals remain undiagnosed. With this case study, the Dallas County Medical Examiner's Office called, and they are investigating the sudden death of a patient. The patient is a 55-year-old black woman seen for many years in a hypertension clinic. Workup at various times has revealed no evidence of renal disease or endocrine abnormalities. On a recent office visit, her blood pressure was measured as 190 over 105 millimeters of mercury. A few months ago, she was briefly admitted to the hospital after she awakened at night feeling a shortness of breath. Review of the hospital records from that admission shows that she had mild ankle edema, basilar, rales, and hepatomegaly. On initial evaluation, a chest x-ray showed cardiomegaly and slight atrial enlargement. An ECG confirmed left ventricular hypertrophy. Laboratory studies at the time suggested minor hepatic damage. Serial cardiac serum markers, enzymes, troponin were negative for myocardial infarction, and over the last few years there had been a steady increase in her serum BUN and creatinine. The medical examiner relates that the patient complained of a sudden, severe, sharp chest pain and collapsed at her husband's softball game. The patient was taken to the hospital where she was noted to be hypotensive with unequal pulses. A chest x-ray revealed a left pleural effusion and a widened mediastinum. The patient died suddenly. An autopsy is being done to determine whether she died from some catastrophic vascular event related to her hypertension. In the first article, Social Epidemiology of Hypertension in Middle-Income Countries, Determinants of Prevalence, Diagnosis, Treatment, and Control, in the World Health Organization SAGE study, defines hypertension as sustained diastolic pressures greater than 90 millimeters of mercury or sustained systolic pressure more than 140 millimeters of mercury are associated with an increased risk of arteriosclerosis and used as a cutoff with the diagnosis of hypertension in clinical practice. Undiagnosed hypertension was defined as those individuals having hypertension by examination but denying there was a prior diagnosis of hypertension. Untreated hypertension was defined as those individuals with hypertension but rejecting medications or treatment for high blood pressure over the past 12 months. Uncontrolled hypertension defined as those with hypertension whose examination did not have a mean systolic blood pressure less than 100 millimeters of mercury and diastolic blood pressure less than 90 millimeters of mercury. The article looked at the proportion of those diagnosed with hypertension who were treated and the percentage of those treated who were controlled. Prevalence estimates suggest anywhere from 3% to 30% of patients with hypertension require greater than 3 medications to achieve blood pressure control. With hypertension, height, weight, blood pressure is a constant variable, and detrimental effects increase continuously as one's blood pressure rises. No threshold thoroughly defines to predict certainty of who will suffer harmful effects from hypertension. Hypertension causes degenerative changes in the walls of large and medium-sized arteries, which can lead to aortic dissection and cerebral vascular hemorrhage. The prevalence of pathologic effects of high blood pressure increases with age and is also higher in African Americans. The second article, Investigating Suspected Heart Failure, discusses how heart failure has some different etiologies. Heart failure should never be the only diagnosis, as it is a syndrome occurring as a result of other diagnostic entities. According to the article investigating heart failure, typical symptoms of heart failure are breathlessness, fatigue, ankle swelling. Typical signs: tachycardia, tachypnea, pulmonary rales, pleural effusion, raised jugular venous pressure, peripheral edema, and hepatomegaly. In this case study, the patient experienced shortness of breath, mild ankle edema, basilar rales, and hepatomegaly. Acute heart failure can present as new onset heart failure in people without known cardiac dysfunction or as acute decompensation of chronic heart failure. In general, the heart fails as a whole. The responsibility falls on one ventricle, and this influences the pattern and the symptoms and the signs. There is no symptom or sign that is both sensitive and specific for chronic heart failure. Prognosis is poor on the whole, with approximately 50% of people with heart failure dying within 4 years of diagnosis. In the third article, Acute Aortic Dissection in Blacks, Insights from the International Registry of Acute Aortic Dissection, shows all signs and manifestations of the case study suggest aortic dissection. Also, the laboratory image shown in the case study exhibits a section of the aorta with multiple areas of cystic medial necrosis. According to the article, the aortic wall, in most cases of aortic dissection, is weakened by cystic medial necrosis. The stain showed the tissue was tinted with an elastic stain that stains the elastic tissues black. The areas of cystic medial necrosis were recognized as zones in which the elastic laminae had been lost. There is a noted decreased and disorganized elastic tissue in a patient with aortic dissection. Cystic medial degeneration is the pathology underlying many thoracic aortic aneurysms and dissections. According to Robbins' basic pathology, many patients with type A dissections are normotensive or hypotensive on presentation. Presentation of hypotensive complicates the diagnosis of acute aortic dissection, which is usually related to cardiac tamponade, aortic rupture, or heart failure associated with severe aortic regurgitation. Sudden chest or back pain accompanied by pulse deficits, aortic regurgitation, or neurological manifestations should alert the clinician to the diagnosis of acute aortic dissection. Almost all Black patients complained of pain at presentation in this article, and an abnormal aortic contour on chest x-ray with signs of left ventricular hypertrophy on ECG was common in Blacks with acute aortic dissection. Furthermore, it notes that the chest x-ray may be the first indication for diagnosis of aortic dissection because of the widening of the mediastinum. Elevation of serum BUN and creatinine reflects a progressive loss of renal function. According to information provided, as the glomeruli are lost, the distal nephron components atrophy, so there is tubular atrophy. These changes are responsible for the loss of renal function. Also shown in the article is such that acute kidney injury is more common in the Black population. Acute aortic dissection is the most common life-threatening disorder affecting the aorta. The immediate mortality rate in aortic dissection is as high as 1% per hour over the first several hours, making early diagnosis and treatment critical for survival. Classification schemes for aortic dissection are based on the atomic involvement of the aortic dissection. The location determines the nature of the complications and risk in the aortic dissection. With the study, there is clinical evidence for aortic dissection as the cause of sudden death. These findings may have implications regarding risk factors modification for decreasing the incidence of acute aortic dissection in blacks. Hypertension and other modifiable risk factors for acute aortic dissection need to be addressed to the population. Robin's basic pathology, although most patients with dissection have underlying hypertension, only a tiny fraction of all hypertensive individuals ever have a dissection. It is imperative that one considers an underlying genetic disorder in the person with acute aortic dissection and that a comprehensive family history is obtained. This case proves how uncontrolled hypertension is one of the most important cardiovascular risk factors in the world now and contributes to the elevated risk of stroke, myocardial infarction, heart failure, and renal failure. The immediate goal for prevention of acute aortic dissection should be directed at control of blood pressure using diet and lifestyle as well as treatment regimen effective at reducing the blood pressure.
Hi, Tempest. In order to add some information to your interesting case study, recently I came across an article that it was very interesting for me. It was the original article, research article, and the title was a long-term comprehensive exercise program that incorporates a variety of physical activities improve the blood pressure, atrial stiffness, and the balance of the middle age and elderlies in Japanese. And so with increased longevity, the quality of life and general health of older segments of society have become important topics of discussion and research. And as you mentioned, hypertension is well known as a major risk factor for development of arteriosclerosis, and sustained hypertension is one of the highest risk factor for cardiovascular disease. The mortality and morbidity rates by CVA are proportionally increased with elevation of blood pressure. The fact that physical activity is effective for the prevention and treatment of mild or moderate hypertension and carbohydrate intolerance and dyslipidemia has been clearly demonstrated, and exercise is recommended in the guideline for management of hypertension. Aerobic exercise with approximately 50% of the maximum oxygen uptake has been recommended as the most effective not pharmacological treatment for individuals with high blood pressure. And so they did a study for 6 months, twice a week exercise program for elderly Japanese, emphasizing of swimming. And then it was between men and women age 50 to 70s, and then they put them on that exercise program for 6 months and twice a week exercise program that emphasize, as I said, on swimming. And they find out that this exercise program significantly improved the systolic and diastolic blood pressure and lipid and glucose metabolism. So I found it very interesting because the physical exam programs are commonly promoted for the prevention and treatment of lifestyle related health condition. Good physical condition allows older persons to live independently and continue to participate as a valuable member of society. So that was a very interesting article that I just want to share with you.
Hi Tempest, your case study about hypertension is very interesting because hypertension is a huge problem in the United States and not only in the United States, even across the world, because especially third world country, many people take it very lightly. Hypertension is the most prevalent cause of stroke and kidney failure, and it damages the kidneys, increase the risk of blindness and dementia. And working at the psych hospital, I come across a lot of patients admitted with dementia, and they do have um, hypertension. Hypertension is known as the silent killer, and people need to be educated about how important it is to not only adhere to their medication regimen, but to do those lifestyle changes that will help with the disease. And though there are many studies that have been conducted regarding hypertension, we need to apply those research into our practice to help eliminate this disease, or most importantly, find effective treatment strategies for patients. And we need to promote education about hypertension, because they take it too lightly. They think it's something that we can fix overnight, and many believe that because they take medications, they don't have to adhere to the lifestyle changes.
Hi, Tempest. Okay, I was interested in your case study as it correlated slightly with mine on renal failure that I did. As you mentioned, hypertension is an enormous public health concern. It is insidious, and like somebody else said, I forget who, people don't take it seriously. I mean, patients don't take it seriously. They think they can take a pill and they'll be fine. I don't think people realize until they're in stage how sick it makes you. It has such a deleterious effect on the entire body. Specifically the renal system and the eyes and the brain and the blood vessels and all the areas that we know about. So as a practitioner, it's very important to identify people with hypertension first of all, and then to maintain control once you've identified it. And in some people, it's easier than others. The problem, it becomes kind of a compounded issue when hypertension is present despite treatment. The refractory hypertension that just doesn't respond after 3, 4, 5 medications. And these patients are at the highest risk, because if we're uncontrolled, then that's prolonging the damage, to all the vessels and the other systems. One article that I found very interesting when I was doing my research discussed a study on the effect of left ventricular hypertrophy in systolic and diastolic function in patients with resistant hypertension. And this is specific to that group of people who are being treated and who are taking their treatment, as prescribed. And it's just not working. We're not finding that mix that's keeping them controlled. We know there's a bit of a direct correlation between renal and cardiac dysfunction. And sometimes it's kind of a chicken and an egg situation. Dysfunction in one can precipitate dysfunction in another, or, either way, one way or the other. And they usually both end up involved at some point. So the Journal of the American College of Cardiology did a study, or published a study in 2012. And the article is called "Renal Sympathetic Denervation Reduces Left Ventricular Hypertrophy and Improves Cardiac Function in Patients with Resistant Hypertension." And in this article, in the study that they did, which is, the article is a review of the study that they did, they explain that persistent hypertension is a product of chronic activation of the sympathetic nervous system. And this, again, is this refractory hypertension we're talking about. Reduction of renal sympathetic activity via this procedure that they do where they take it's like a percutaneous endovascular radiofrequency ablation of the renal sympathetic nerves, decreases systolic and diastolic blood pressure. And they knew that was not a new thing that they had discovered, but they were intending on doing some research on what effect that had once it had been done on left ventricular hypertrophy, because apparently nobody had decided to look at that yet. So their study looked at 64 patients with refractory hypertension. 46 of them had the radiofrequency ablation, and 18 were controls that did not have the ablation. Some demographics, the average, or the mean age was 63. They were mostly male. The average amount of medication or number of medications that they were on was 4.7, and all of them were on diuretics in addition to their antihypertensives. So they took this group, 64 of them went through the procedure, and then of course they monitored them over the course of 6 months, with echocardiogram and all the things. The findings were very interesting to me, very promising. I think it's fascinating. The left ventricular mass index decreased in the what they call the RD group, which is the group that got the ablation. So the left ventricular mass index decreased from 53.9 grams per meter squared to 44.7 at the 6-month mark, as opposed to the control group, which increased from 55.7 to 58.6. Also, in the RD group, the ventricular septum thickness decreased from 14.1 millimeters to 12.5 millimeters, and there was no change in the control group. Also, in the RD group, there was a bunch of things that improved. They had an improvement in ejection fraction. They had a rise in end systolic volume. They had a decrease in diastolic dysfunction. So overall, what this looks like for a big picture is, obvious. It leads, to improved prognosis for these patients and improved outcomes. Because if we can, take what we thought before was a kind of a permanent remodeling of the heart, you've got left ventricular hypertrophy, which is this, chronic, thing, and find a way to reverse some of the damage. It doesn't reverse all of it, but it definitely improves it, and it keeps it from progressing, which is important. I think it's kind of exciting.
Hypertension is a serious global issue that needs to be addressed. To me, hypertension is considered as a silent killer. As you mentioned, a lot of people in developing and poor countries die suddenly from untreated hypertension, since its symptoms only appear later when it has already caused major damages. A lot of hypertensive patients usually do not even know they suffer from it, since most of them do not seek any health care, or some of them are non-compliant, or some of them go through denial of having the disease, so they just live with it and ignore it. And some hypertensive patients have other comorbidities that affect and increase their blood pressure. Like, for example, at my job, most of the patients I take care of are patients who have kidney diseases and they're going through dialysis. So they usually have high blood pressure. If they're not already on blood pressure medications, their blood pressures, they have hypertension. And sometimes their blood pressure drops when they are going through dialysis, and they have to be treated for hypertension. And then the cycle continues. So it is difficult for patients themselves to have to go through all the issues that comes with hypertension. or take medications constantly to stabilize their blood pressure, besides other diseases that they may be suffering from. Therefore, as nurses, we need to always do accurate assessments and check our patients' blood pressure each time we administer treatments that can affect their blood pressure. We need to also educate our patients to follow a strict diet and avoid situations or instances or anything that can affect their blood pressure, because it's going to be helpful. Some patients actually do not know, they're ignorant, or they just need to be motivated. So reinforcing that and encouraging them to stay strict with the diet that the doctor has prescribed to them will be helpful to the patient. Also, we can go to into our communities, just do some kind of educative programs, and then check people's blood pressures and refer them to the hospital to be treated if needed. Thank you.